Hi, I'm Sandra Smith. I'm actually a physician assistant working at the Fayetteville VA Medical Center and Women's Health. Fibroadenomas are common, they're benign, meaning they're non-cancerous breast lumps that are found in the breast. These breasts are usually rubbery, they're smooth, they're actually solid. They can be either multiple or by themselves. These lumps are actually painless lumps, and they can be anywhere from a pea size to a marble size for these fibroadenomas that are found in the breast. Fibroadenoma is actually more common in our younger population, more in our Caucasian. You think around the age of the late 20s, we usually see patients with fibroadenomas. Usually in our African American or women of color, they usually present a lot earlier, even in their teens. So they present a lot earlier. So those patients are more prone to it. You see it in our adolescents. You see it in the college teenagers. So all these patients present very, very early with fibroadenoma. However, they can actually occur at any age up until menopause. Fibroadenomas are very responsive to hormone levels. Therefore, women taking hormone therapy can actually get them even after menopause. This is due to hormone sensitivity. Fibroadenomas can change their size, varying on the hormone levels during pregnancy, during the menstrual cycle. All that actually varies the level of hormones, actually makes persons more or less prone to developing fibroadenomas. The symptoms of fibroadenomas, sometimes again, like I said earlier, they're very painless. So patients have no pain whatsoever, which is why it's very important for patients that do self-breast examinations. And that's why I tell patients, especially my younger populations, it's best to know your body. You have to know your body better than anybody else, because these lumps or mass or whatever term you want to use are actually there, and a lot of patients just don't know it. And if you're not doing an exam, you won't catch it. Fibroadenoma is diagnosed first and foremost. The number one way that I stress to my patients, fibroadenomas are diagnosed. No one knows your body better than yourself. And with that being said, I strongly stress about self-breast examination. Self-breast examination is the first and foremost way that fibroadenoma is actually diagnosed, because patients actually find a lump on their breast. So either the patients find it, sometimes their partners find it, or either it's found on a clinical breast exam by your healthcare provider. So that's the first way that fibroadenomas are usually diagnosed. And once they're actually found, the next step is usually mammography. So we usually do some form of mammography on the breast tissue, looking a deeper view into the breast. After mammography, and especially with our younger patients, because these breasts are actually very, very dense tissue, we use ultrasound. Ultrasound is actually recommended to rule out any other breast disease that may be going on. It's ultrasound is very, very useful and accurately measuring the size, to determine the number, and also to provide actually growth of a fibroadenoma over time. So if you actually wanted to measure fibroadenomas, if you want to actually see if you do a 6-month follow-up, if you want to just kind of wait and see if this fibroadenoma is growing or changing over time, ultrasound would be the best bet for that option. Treatment of fibroadenoma actually depends on the patient's needs, depends on the concerns of the patients, also depends on just the expectations of the patient, sometimes their parents, what they expect, what are their outcomes. Mostly what we do with patients with fibroadenomas, we use to monitor them. We used to monitor them through breast exams. We used to monitor them through clinical breast exam with the healthcare provider. Another way to monitor a fibroadenoma is kind of what we talked about earlier through the ultrasound. So we can actually monitor them and kind of tell whether or not they're progressing, meaning whether they're changing in size or not, is through the ultrasound as well. And that's usually determined by the radiologist. So that is one way. You can use an ultrasound guided core biopsy. With the ultrasound guided core biopsy, that's actually this is actually recommended, and this is recommended to rule out any other type of breast disease that could be going on. So with this core biopsy, you go in, you take a sample of the tissue, we send it off to pathology just to find out exactly what this tissue is. And with that, treatment is determined from there, whether or not we want to sit and watch and wait. It just depends on what pathology shows. So then if we have somebody that says, you know what, no, I do not want to watch and wait, then we go to the next level. Or if we have someone that says, you know what, I want to watch and wait, and you come back in 6 months and this tumor or this lump has grown more than at least 2 centimeters, then we actually recommend this coming out. And that is what we call a lumpectomy. So that is surgical removal of this fibroadenoma. So we will take the patient to the OR under anesthesia and actually move the lump from the breast. And normally we don't try to do that unless the fibroadenoma is growing. Other than that, we will leave it in place. And these are just some of the treatments of fibroadenomas. However, there's actually a new treatment on the market now, and it's actually a fairly new procedure. And with this procedure, what happens is actually it's called cryoablation. And with the cryoablation, what we do is actually use extremely cold liquid nitrogen. And this liquid nitrogen is actually used to destroy the benign is non-cancerous tumor cells of the breast. And this can actually be done in an outpatient setting where a patient doesn't have to go in the OR and be under anesthesia. So this is something new that's new on the market now. Because we really don't know what causes fibroadenomas other than the unopposed estrogen. And then we also don't know really what causes breast cancer. The answer is in long-term studies, the answer will be yes. There's a lifetime increased risk of breast cancer with persons who have had or have experienced fibroadenomas. And this risk is relative around 2.6% risk if these persons have had a fibroadenoma in the past. So if you've had a fibroadenoma at a younger age, this obviously would increase your risk as well. So these patients definitely need to be screened on a routine, regular basis. All patients need to be screened on a regular basis, but these patients need to be on a regimen of following up closely. And then if you add the family history, you look into their family history and someone in their family history has had breast cancer, this breast cancer, that increases their risk factor, as well as smoking. So if you add all these risk factors to fibroadenomas, it definitely increases your chances of developing breast cancer. So yes. It's actually kind of hard to really tell the preventative measures of fibroadenomas because one, we don't know exactly what causes it. And because we don't know what causes it, we really don't know how to prevent it. With that being said, there are some things that we can do to decrease the risk factors. So one is decrease the caffeine diet, so decrease caffeine intake. Also for patients especially patients who have a strong family history of cancer, to not put these patients on estrogen, because we do know that fibroadenomas respond to estrogen. So because of that, we don't put patients with a history of fibroadenomas, we don't put them on estrogen whatsoever, because we don't want to increase that risk of cancer or them developing cancers. Other than that, we more importantly, I always go back to self-breast examination. That way you prevent something because you'll find it early. Early prevention is very important. patient can actually contact their healthcare provider at any given time, especially when they find any type of lump, any type of mass, any type of anything that's out of the norm for that patient. If they have any bloody discharge, if they have any dimpling of their breast, if they have anything that just seem or look abnormal for them, they should definitely contact their healthcare provider just to make sure that nothing is wrong. And it's always better to be safe than sorry.